and that, or his suprasternal notch. All right. Now, if you come down here, oh, he's got a nice one right here. You're going to feel a little ridge or a little protrusion here. That's his sternal angle. So from here to here is his manubrium. Okay? So this is at the superior border of the manubrium at the sternal angle, at the suprasternal notch. You are at T2 vertebral level. The manubrium goes from T3 to the sternal angle at T4, T5 disc. Okay? All right. Now, at this level, it also lateral to it is the second rib, right there. That's the rib that you're going to count off of because you can't palpate the first rib. It's underneath the clavicle. Excuse me. So here's your second rib. So right here is the first intercostal space. Okay, 0.5 chunk from the sternum right here would be kidney 27. Okay, so here's your rib cage. Then you go down below the second rib, and that's the second intercostal space. Okay? All right. So then from this angle, go down to right here is the ziphosternal joint or angle. All right? So from here to here is T5 to T9 level of vertebral level. Okay? That's your sternal body. Then just below the sternal body, you have the xiphoid process. Now, some people you can really palpate it well. Some people you can't. As you get older, it's really cartilage, but as you get older, it ossifies and becomes bone. All right? All right, so right below that is CV14. Yeah. Okay. Now, all right, so that's that. So I can ask you a question on the practical next week, okay?
Practical next week?
Yes, it is. Already, I was like, my brain was floating also. Count for me to the fifth rib. All right? And I would expect you to give me the procedure. The procedure being is palpate for the sternal angle, come across to the second rib, then count 2, go over the third rib, 3, go over the fourth rib, 4, go over the fifth rib, 5. Okay? So that could be a question.
So the fifth rib is below the fourth intercostal space.
The fifth intercostal. No, the fifth rib. It's below the fifth rib. The fifth intercostal space is below the fifth rib.
Oh, okay. So it's below the fourth intercostal space.
No, the fifth.
No.
You're talking about the fifth rib.
Well, yeah, it's below the fourth intercostal space, but why are you saying it that way? Say it's below the fifth rib because it's going to confuse you.
No, I'm saying the fifth rib is below the fourth intercostal
Yes, okay. The fifth rib. You didn't say that, though. You said
Okay.
intercostal space. That's why you were confusing me. Didn't he say that, or am I? Okay.
No, you got it.
All right. Don't confuse
So it's
me.
not
I'm very
under the
easily
fourth
confused. What?
intercostal space?
Each intercostal space is below the rib it's named for.
Oh, okay.
Okay? So if you have the fifth rib, below it is the fifth intercostal space.
But above the fifth
Is
rib
the fourth intercostal space.
Okay, all right. Okay, thank you.
You're thinking backwards, though. You're trying, making my brain
okay.
fall out here. Okay. Now, it's easier first to palpate the ribs, the floating ribs, if we turn them over. So everybody pretty much has that down, okay?
Yes.
Okay. While we're on this front, on the supine, I'm going to go over the triangles, okay? So, the anterior cervical triangle, the anterior border is the midline of the neck. The posterior border, if we turn his head, come up a little. There. That was good. Wait. Bring your head up a little bit. there, like that. Now hold it, just leave it there with my hand, okay? All right. This is SCM, sternocleidomastoid. So you have midline sternocleidomastoid and inferior border of the mandible. Okay? That makes up this anterior cervical triangle. Within that cervical triangle is chi, common carotid, hypoglossal nerve, and internal jugular. All right? So that's that. Now, before we go any further with that, what's this here? Which fossa? No.
No.
Lesser supraclavicular fossa.
What is it?
Lesser supraclavicular fossa. Okay? And what blood vessels in there? Internal jugular. Very good. Now, so that's your, this area in here, you see this depression here?
Wow.
That's your greatest supraclavicular fossa.
Why? Because it's bigger?
Yeah. Okay? Now, this whole muscle here is your SCM. It has two bellies. 1, 2. All right? Now, see this? This is your external jugular vein. Okay? Now we're going to go into the posterior cervical triangle. So the posterior cervical triangle, the anterior border is the SCM, right here. The inferior border is the clavicle. And the posterior border is the trapezius, which is right here. Okay? So that's the posterior cervical triangle.
So it goes behind this.
It goes behind the second belly of the SCM.
Okay.
So it's behind the lesser supraclavicular fossa. Okay? But right in this corner here is your omohyoid. Now, what artery is in that place that you're supposed to be able to palpate the pulsations? What artery? What artery? Subclavian. Subclavian is supposed to be right in there. All right. So now, in this posterior cervical triangle, what blood vessels, or what do we have?
Base.
Base. Good. So what is B?
Brachial plexus.
Brachial plexus. What is A?
Accessory nerve.
Accessory nerve. Good. What is S?
Subclavian.
Subclavian artery. What is E?
External.
External jugular. Okay? Very good. Yes. She's been studying. Good girl. Okay. Now, the other thing you should know is the different things here. First of all, is hyoid bone, right? Swallow. And you should be able to feel the bone moving downwards. Okay, the hyoid. Which is part of what? The axial or appendicular skeleton?
The axial.
Good. Okay. And that's at what level? C3.
C3.
Oh, you got one wrong. Oh my God. C3. Okay. Now, see the Adam's apple on him? Now, on females, it's hard to see that. Okay. On males, it's much bigger. All right. So that is the superior border of the thyroid cartilage. All right. So there. That goes from C4 to C5 vertebral level. If you go from here to the SCM, you're going to have stomach 9. Okay, go here to the SCM, stomach 9. That's right where the carotid artery is. That's right where the internal jugular artery is. Vein, is. Okay? Now you go just below it, and you'll feel another cartilage. That's the cricoid cartilage. That's at the level of C6. At the cricoid cartilage, that's where the pharynx changes into the esophagus and where the larynx changes into the trachea at that level. Okay? All right. So I think we did all of that. Do I have to go over the bones of the skull? Do you know? You basically know. Yeah, she'll be tested on anything we've had. Go over them fast.
So here about the sternum, so there was the second, begin for the second rib.
Intercostal. Go for the second rib from the sternal angle, which on him is right here.
So it starts
So
the
right-
second.
So right here, where is his rib? Here, right there is the second rib.
That's at the body, right? Here is the.
This is, no, it's right between the
the body.
body and the manubrium.
Oh, the manubrium. I'm
That's a
saying.
sternal angle, okay? All right, we'll get into that later. I'll go over it with you, we'll palpate it. You want to go over all the muscles, all the things of the head.
Okay.
What's this bone?
The frontal.
Frontal, okay. What are the two bones over on either side here?
Parietal.
Okay, then what is right on this side, right here?
Temporal.
Okay, and what's right in front of it and kind of attaches to the parietal, the temporal, sphenoid, the greater wing of the sphenoid. It's one bone, but it comes from this side, it goes through to the other side. It forms the back of the orbits of the skull, of the eyeballs, all right?
It's only
Of
one
the-
bone that connects?
It's only one bone. Okay, excuse me. In back here, what is this?
The occipital.
And what is that knob at the occipital? EOP, which is the external occipital protuberance, okay? All right. We did all of that. Okay, good. So now, in the front, the facial, now those are all flat bones, okay? They're protective bones. They protect the brain. Then you have the irregular bones of the face. And you have right here, the cheekbones right here are the zygomatic, right? Okay, the two bones right here are what? The nasal bones, right? Very good. Inside the nose, you have what we call the septum or the vomer bone, right? And then you have the conchae, which are like shells, bony shells on either side of the nose, which are also considered irregular bones, okay? Those are the conchae, all right? This here is the only movable, truly movable bone, and that is the mandible, okay? This, in this area here is what? Maxillar, and there's two of them, okay? Right inside the orbit of the eye, there's a small bone, it's the lacrimal bone on each side, okay? And behind that, there's the ethmoid bone, okay? And that also goes into part of the nose or the nasium, okay? All right. I think we got them all. Okay.
Only thing I got confused with the processing here.
All right, so now
the
let's go through that.
condyle.
All right, let's do that. Right here, this here is your zygomatic arch, which is part of the temporal bone. It's not part of the zygomatic bone.
Even in the, okay.
Okay? Right underneath that is stomach 7. Good bone for TMJ. Okay? All right. Then you have, all right, let's go through some of the muscles. We'll go through the muscles of mastication. All right? Right over here, you have your temporalis. Helps with elevating the jaw. Okay, so feel it? It's right there. All right? Then you have the masseter, which is right at the angle here, right up in this area, in this direction, like that. The masseter, again, if we're looking for stomach 5, if you go, you find make like you're blowing something. Okay? You should be able to find the border of that masseter muscle. Right here would be stomach 5. All right? Right there. But that's the masseter. Right in here. Yeah, right there. Okay? All right. All right. Underneath, if we were to palpate underneath here, which is like going in the same direction as the masseter, okay? That's your medial pterygoid. That laterally deviates and also helps with protruding. Okay? And then in here, which you only can feel with your finger all the way back here, is your lateral pterygoids. Okay. And those, when I have a person with a TMJ problem, I literally take a finger cut and go in there and I push it out. It's very painful. On some people, it's very painful. You could do it to yourself. Later on, put your own, in your hand, put your fingers in here. Feel which side is closer to the other. You know, which jaw is closer to the teeth. Okay, which jaw bone is closer to the teeth, which side. And when you do that, if you go in and pull it out a little, you probably have a TMJ problem, and that'll help release those lateral pterygoids. Okay. TMJ is a temporal mandibular joint. Okay. All right. Now, people, I want you to. This here would be his rectus abdominis. So try to you don't have to, but try to make like you're coming up. No, you're pulling your trunk up, and you'll feel the contraction. I want you to feel that, okay?
Oh, sorry, wait. The TMJ problem, that's like pain with the TMJ? Or?
Yeah, you have pain and you have clicking sensation. You could also have headaches from it sometimes too.
Okay, I see.
So
you're
if you
supposed
have,
to pull it out?
yeah, open your mouth. Yours is a little too posterior, but not as bad out of alignment. But you usually could tell if you open up the mouth and it's deviated to one side too.
Sometimes when I clench my teeth, it
Yeah.
hurts right here.
Yeah,
Is that
so that,
TMJ?
yeah.
Okay.
So that if it hurts in there,
Uh-huh.
put your fingers in the back of your jaw to against the upper teeth, and whichever side is really tight and really close, then you just pull it out. Just rotate your finger like this, and it'll open it
Just
up.
rotate?
Yeah, that's it.
Okay.
But inside
Inside the mouth, not
Inside the
outside.
mouth?
Yeah.
Okay.
All right. So now, the intercostals, you're gonna feel right here with the ribs, okay? And take a deep breath, and you're gonna feel them expand, the external. Now, exhale, and you'll feel the internal ones kind of expand, contract. I didn't mean expand. You feel the expansion, but it's the contraction of the external intercostals, all right? And on exhalation, it's the contraction of the internal intercostals. So I want you to feel that when they breathe, okay? The external oblique is really the only one you're going to palpate for with the contraction. So what you're going to do is try to rotate to that side, and you're going to hold just with your just go like no, not you, just the trunk, move to that side. Roll like this. Don't keep your hips down.
Okay.
I just
Only
want your
your
trunk.
trunk.
Oh, all right.
Okay, and then go back. So do it again, and you're gonna feel the contraction, and that's your external oblique. Okay, that's your external. You're not gonna feel any of the transverso abdominis is too deep. You're only gonna feel that upon when you're really trying to expel abdominal contents, so you're really forcing in some way. Okay, all right.
This the external.
That's the external.
This
The internal you're not gonna feel either. Okay, so don't worry about it. You're just doing the external obliques, that's all I'm holding you responsible for, okay? You're gonna also palpate, all right, so now we palpated the SCM, right, which helps with flexion and lateral rotation to the opposite side, okay? The SCM. And then, so here's your trapezius muscle here. Let me see if I can have you, let me just go like this, rotate. And you can almost see the line right here, that's the trapezius. So now, right over here, as you go in here, you're gonna feel the splenius capitis. Should be right in here. Can you laterally flex your head a little bit? Just laterally flex it. Yeah, right, it's laterally. No, that's not lateral, this is lateral. All right, and it's right here, okay, right here.
What?
Laterally flex, laterally, like this, and laterally flex, right in there.
This one.
Yeah, right in there, it's up, okay?
What's the name of Morse?
The splenius capitis. The other one that's up there is the the semispinalis cervicis, but we're not gonna go for that because it's deep, okay? So don't worry about it. But that's underneath that splenius capitis. That's underneath also the levator scapula, which we'll get to next half of the semester.
The levator is underneath.
The levator scapular is below it, is inferior to it, but it's not underneath it, okay? So you have the splenius capitis above in the posterior cervical triangle, and then underneath that, or inferior to that, not underneath, inferior to that is the levator scapula, okay? All right, now, I think we could turn them over. Are you ready to turn over and go to sleep? Or do you want to have somebody else
It's
skip?
almost like,
What?
Roll over. Land
Face
your
down?
stomach.
Yeah, face down.
I'd rather have someone.
All right, have
Yeah,
somebody
'cause I
else.
want to see